South Korea, as of today, has now had more than 10 million COVID-19 infections since the pandemic began. That's 1 in 5 people who've at some point been infected. And today, new cases were at the second highest number on record. Meanwhile, the Prime Minister is saying the turning point will come in the next 2 weeks. Shin Ye-eun reports.
South Korea on Wednesday reported 490,881 new COVID-19 infections. This is a jump of more than 90,000 from the same time last week and up by more than 130,000 from Tuesday. Wednesday's figure has brought the number of total COVID-19 infections to over 10 million, at 10,427,247. The total tally suggests that 1 out of 5 South Koreans has contracted the virus at some point. Meanwhile, health authorities have clarified what they class as reinfections. In a briefing on Tuesday, health authorities said in order to be considered reinfected, 90 days must have passed. Citing domestic and overseas data, authorities said positive tests within the first 45 days may be a result of viral residue being picked up through testing and that reinfection risks are very low during this time period. It's only those who report symptoms or those who have traveled abroad and come back with a positive PCR test result after 45 days who can be considered reinfected. As to when South Korea will see a drop in the number of infections, Prime Minister Kim Bu-kyum said this will happen in the next few weeks.
The next 2 weeks will be the turning point in overcoming the pandemic. If we endure this a bit more and abide by all measures, we will see caseloads come down quicker and reduce the number of deaths.
The Prime Minister added that authorities will make sure to have enough ICU beds and specialized hospitals for COVID-19 patients in case there's a surge in the number of critically ill patients and deaths after passing the Omicron peak. Authorities are also set to solve the shortage in cold medicine that pharmacies nationwide have been seeing. This comes as there has been a surge in the number of people infected with COVID-19 or showing related symptoms. Shin Ye-eun, Arirang News.